Hello, I'm Rebecca, the founder of triiyo, and welcome to PEP Talks with triiyo. triiyo is the leading solution for workplaces to support their people during every life transition, from starting a family to retiring and every life event in between. On PEP Talks with triiyo, we chat to our expert partners for advice on how to best navigate these common, complex, and often messy life stages that happen during our working career. Keep listening as we connect the dots between life and work with the simple aim of education and empowerment. After all, life happens at work. Hello, and today on PEP Talks with triiyo, we're speaking with Tom Bosna, Managing Director of Pinnacle Health, and we'll be discussing the importance of wellbeing programs even in a downturn. Welcome, Tom. Great to speak to you again.
Thanks, Rebecca. It's been a little while since we chatted. It's good to see you again.
And you, and I love the fact that you've got your cot in the background, because I think you'd only just had your second child when we last spoke. So it's
still
good.
living the dream. Yeah,
still living the dream. Working parenthood.
Absolutely, still juggling.
Always juggle. So could you tell us a little bit about yourself and the work you do at Pinnacle Health?
Yeah, well, you've introduced me there as the managing director, which makes me sound semi-important. I'm not that important, but yeah, I'm Tom. I've been at Pinnacle Health Group now, or we've been working in that business for about 15 years. And my background is actually as a physiotherapist. So I've been doing it for a while. And basically the first idea or the first concept that we came up with, which was fairly original at the time, which is back when people were wearing carrying briefcases to work and Blackberries to work as well, and working 9 to 5.
That's a long time ago.
Yeah, that's right. The concept was a corporate wellness centre. So basically at Pinnacle Health Group, that's where we started. And since then, we've grown our business, and I've been a part of growing the team across Melbourne, Sydney, and different parts of Australia to help inspire healthy change in different workplaces.
Amazing. So I know you've worked with over 200 organizations on their wellbeing strategy and creating wellbeing programs. What makes a wellbeing program successful?
Yeah, well, it's a lot of clients that we've worked with. They are from, probably worth mentioning that they are from different sectors as well. And so whilst some of our bigger obvious clients are ANZ, Westpac and EY are quite big and notable, we've got a range of clients from different different sectors and different demographics. And so what we've found though over especially the last 3 years, which have been a bit crazy with COVID, of course, and even before that, wellbeing programs especially were becoming more popular, and certainly in the last year, if you go on LinkedIn and you probably get haunted or sort of almost sick of seeing wellness program or people talking about mental health awareness months every what feels like every month. And so there are a few key factors that make a wellbeing program really successful. And Rebecca, what we've been doing the last 3 years is we actually worked with our clients, not all 200, but we picked a small cohort to work with, and we worked with them to try and figure out what makes a successful wellbeing program. And so we created an assessment from that, an assessment tool that everyone can use. I also think it's quite interesting as well that in Australia there's around 2 million small to medium-sized enterprises versus 4,000 large businesses. SMEs, of course, making up such a large number. I kind of immediately think of those small to medium-sized business owners that are trying to work through or have worked through the last few years, and how they can bring some value and a focus on well-being for their staff as well. And so with the wellbeing programs, however, the assessment tool that we've created is called it's not that original, it's called the Workplace Wellness Program Scorecard. And what it does is, there's a bunch of different segments that people can benchmark against. And what we found by interviewing our clients is that there's really around 5 key areas that really make a wellness program go really well. And so the acronym that we've come up with, or the thing that we promote and talk about a lot, is SPACE. And so there's the acronym meaning that the S starts and really stands for structure. So basically, if an organisation is trying to start up a wellness program, and where they've been over the last few years, especially and before that, sometimes that comes across as a little bit, I guess, scattergun and ad hoc with health events, or let's do another wellbeing webinar, for example, and it comes across and presents as a little bit, scattergun. And so one of the key elements of creating a really great program is having some really good structure. And one of the things I wanted to share with you is that through the 2000 health and wellbeing leaders that have filled out our assessment, 80% of them actually said that they didn't actually launch their wellbeing program with an official kickoff, meaning that under one of our guidelines is that if you're not really celebrating or starting the year off with a bang, or really your employees learning about your wellbeing program as a starting point, you're not really setting it up for good structure and also good promotion as well. So that insight there is quite interesting from a structure perspective. And when I say structure as well, I'm talking about like a plan, having a really solid plan for at least 12 months so that employees really understand what's coming up in the program, and also they can identify some of the things that they might like to get involved in as well, to suit their, wellbeing needs as well.
And I think the big thing there that strikes me is if an organisation isn't going to promote their wellbeing program, then they're not going to get the ROI on it either. And also, if you're not promoting it and people aren't using it, not only you're not going to get the ROI, but your people aren't going to benefit from it, which is the whole reason why you put it in the first place, is to help people. If people don't know it's there, or they can't access it, then you're really dropping the ball.
Yeah, exactly. It's just a really missed opportunity, especially because we know that so much work goes into creating a strategy, and for the bigger companies, they'll have their own team of health and wellbeing leaders that can, they can work on their own strategy and maybe use our assessment just as a cross-reference. But what we've actually found, to our surprise, is that that missing that real kickoff, or that real promotion and celebration of what they've put together, which if you miss that, you then miss the engagement, obviously, as well. Probably, Rebecca, just another one that's like I didn't talk you through the whole acronym, but the P starts for in the wellbeing program scorecard, stands for psychological safety. You've probably heard a lot about that. Obviously, it's a really key element to just a workplace, but within a wellbeing program, there's definitely some things that can be done to enhance psychological safety. And, I guess at a basic level, psych safety is about, team members feeling safe, freedom to share their thoughts, or, feeling supported and coached when needed, but also being allowed to take risks in their role, but measured risks, and making sure they're sort of allowed to do that. And so within that, I guess what I'm talking about is, I'm kind of going into initiatives or things that can be done here. But what we've found as well through our chatting with clients and assessments is that leaders generally don't feel that skilled or comfortable in having one-on-one conversations with their staff. And through our assessment as well that we've created in the 2000 plus survey that we've collected, 70% have said that they actually don't have regular access to their managers to have one-on-one conversations for feedback with their team leader. So that seems like an obvious, one to address. And also through leadership training and development, which is something that we do through our programs, you can really just upskill your leaders in how to have that conversation.
It sounds like then that employees are looking to have more access to their leaders and their managers to have these conversations. But on the flip side, those leaders also need to be able to address the more or emotional element of leadership, is to have some training in terms of, how do I support people, which is one of the things that we always talk about, is leaders how is a leader meant to be across, having all of these conversations when life happens to your people at work, whether it's parental leave, mental health, divorce, menopause, whatever it is. Those are really hard conversations, and they're often complex people issues and highly emotive. And it's not surprising then that leaders are reluctant or unsure or not confident having those conversations, because they are complex and emotive and challenging to have. But it sounds like actually the people do want to have access to these, have those conversations. But to do that, you have to have a psychologically safe environment for both parties to be able to have those authentic conversations. And psychological safety can be quite hard for organizations to create, right? Because it has to come from the top, culturally come down, so that everyone feels that they can show up fully and completely as themselves.
Exactly. Look, it's been bloody hard for leaders. Let's be honest. And I've had leaders of very large teams in corporates say to me, as we're going through our consultation around this, they're like, am I meant to be a psychologist? And the answer is, well, no. However, there's conversation or skills and one-on-ones that could be sort of ritualized into their team environment. There's also a lot of other elements that I'm not really touching on, such as like role clarity and structure around everyone's role and meaning, and feeling dependent on, and that kind of thing. There's heaps to it, but I just think as a starting point, and what we've found is that we've talked a lot about employee burnout in the last few years, but leadership burnout as well has been quite significant, meaning that leadership, the whole game has changed really fast, and so everyone's trying to catch up and figure out where they sit and how to lead in a hybrid workplace.
So P, psychological safety. A, where are we at with A?
Yeah. No, thanks for keeping me on track. With A, it's really about awareness. And so this seems obvious, and this acronym seems so simple, but when we've broken it down and put it in our assessment tool, awareness is all about marketing effectively. So how do you market? You might have a bunch of health and safety or health and wellbeing people putting together this amazing program with lots of stuff in it. But as I said at the start, if they're not launching it, and more importantly, if they're not consistently marketing or messaging this out through the different channels that are available in a corporate environment or even in a blue collar environment, and we've seen our marketing assistance to like a corporate where they might use Yammer versus an industrial site where they might use posters and QR codes in the lunchroom. There's different ways that you can promote what you're offering, but the key is that you don't do all the work at the start and then you forget to promote it as regularly as you can. And so one of the other parts of awareness is that what we want to do is one of the key parts of creating a successful wellbeing program is creating a wellbeing committee, where your wellbeing champions, which I'll talk about in a second, they get together at a regular cadence. It might be quarterly, for example, and they review the wellbeing program and plan and tweak and make adjustments as they go. And so through our assessments that we've collected, 60% have said that they're not actually meeting quarterly as a wellbeing committee, meaning that my assumption here is that they're not reviewing things at a regular pace. Therefore, probably the awareness and the promotion that would come out of those types of meetings is probably then slowing down as the year goes by, and fair enough, because there's a lot that can happen in a large or small organization.
So C is obviously your champions, and that's obviously important because that's going to keep the focus on well-being across the organization.
Absolutely, yeah. One of the big things of champions is in every team or every organization or small business, there always is a very enthusiastic bunch of people that will get involved in all the wellbeing initiatives. Maybe they're a passionate fitness person, maybe they're have a lived experience in mental health that they want to share perhaps, or maybe they're a working parent that is juggling and they are part of a community group that they would like to bring into the workplace. With the champions, though, one of the key parts of that is one of the key questions that we talk about is, does the CEO or the team leader get involved and also be a champion for the health and wellbeing initiatives or programs that are in place? And so 50% said that the CEO director hadn't really got involved or haven't been involved in the communications or the championing of the program. I feel like that's a missed opportunity. We've got clients where the CEO is 100% part of the whole thing, and those companies really, those engagements in those wellbeing programs huge in comparison. I also think that one of the other elements of champions is, as I said earlier, is just getting together at a regular rhythm to then create or deviate the plan as needed. And with that comes those champions meeting their other employees or their other teams and getting feedback as they go, so they understand what's working and what's not. Because just like a startup, it's important to adjust and change the plan if needed.
Yeah, that makes total sense, doesn't it? And what about E?
Yeah, well, E is all about evaluation. And as a physiotherapist by background, I've come from a sciencey background, if you like, where, you know, we assess people, we treat them, and we reassess. And so with a program, it needs to be backed by evidence and science. It can't be just lots of yoga classes, or it can't just be lots of webinars without much measurement of health outcomes. And so one of the key things for evaluation, and we do this with very, very large clients, where we look at the organizational health profile and we collect different data points. And what we then do is look at the before and the after with those assessment points, so that then we can report back to the organization. And some of those data points might be around chronic disease risk factors. It might be around mental health as well. And so before we actually kick off a wellbeing program in the strategy phase, we actually work out, what do you want assessed, and therefore, and what changes do we need to make? And what we find is that once the report is done on those assessment and those data points are collected, we can look at before and after. And then what we can do is plan for the following year, so that it ends up being, it might be year one is a program that's specifically looking to reduce a certain disease risk factor. And then the following program that follows is more around increasing activity, perhaps, or physical activity, to help address the findings from the year before. What we've also, through our assessment findings, we're finding that about 50% of those respondents have said that they aren't comparing year to year those data points, meaning that, you know, each year they're sort of perhaps starting from scratch, or they're going a little bit more on feel rather than data and what they actually need.
So evaluation is obviously really important. So organizations come up with, this is what I want, this is what we're looking for, and this is what we want to get, you know, from an outcome. Now, if we focus on that outcome that people are getting, I think employee wellbeing and focus on wellbeing in a downturn is still a strategic priority. It shouldn't be the thing that gets shelved from a financial perspective, because actually the value it delivers within an organization is high. So if we were to look at those evaluations and, you know, the outcomes that you're seeing with your clients, what would you know, what do they look like? You know, what are the reasons? What can people expect, organizations and leaders expect to achieve by maintaining their focus on well-being, even through these, you know, these challenging times?
Yeah, it's a good point around challenging times, or, you know, economic downturn. We're seeing a lot of startups or a lot of tech businesses completely wiping a lot of their workforces to sort of ride the bumps of the times. I guess with wellbeing programs, there's different ways to look at it. One of them could be, and this is the conversations that we're often in each week with new clients or different, you know, existing clients. We can look at it in a couple of ways. So it could be that the wellbeing program is a way to attract and retain Gen Z employees. We know that Gen Zers are taking over the workforce and will make up quite a significant amount of the workforce by 2035 or 20. I think it's 2035. They'll make up about 70% of the workforce, and their number one priority in a workplace is flexibility is number one. Number two is wellbeing, and three is pay, and the fourth one is actually learning and career opportunities. I've quoted a research paper there, but I don't know the name of the research paper, but that's something that I've read not too long ago. And so you can look at it as like, all right, well, if we are going through an economic downturn, what are we there's a lot of talent out there, and they're maybe a little bit pickier than previous, or that they've actually got more options now. So let's put this wellbeing lens on this. Let's make sure our program includes flexible working policies, obviously, but let's look at a program that really caters to that demographic and what they're going through in their life. So maybe that's an employee who's maybe looking at their finances and looking at buying a house. So why don't we put some financial well-being in there? And maybe that's important to them. Maybe they're a new parent or a young, they're hitting that age where they might become parents. So working parents programs to assist these types of people. We know that with wellbeing programs and effort and targeted effort around mental health, that there's a great return on investment, meaning that for it's a 6-to-1 a return, if that makes any sense to you. So for every dollar spent is $6 return on that effort, which is I think is a good return. The other factor as well that I briefly touched on, and because I'm a physiotherapist by background, I'm really interested in chronic diseases as they develop through someone's lifetime. One of the things that's important with chronic diseases, and when I say chronic diseases and our evaluation part of a program, what we can actually do through that is pick up the risk factors, the health risk factors for people developing chronic diseases, because they develop during someone's working life. But one of the key sort of bits of information or relevant information here is that workers with 2 or more chronic illnesses take 2.5 times absence when they're off sick than those with 1 or none. So what that really means is that you really, as an organisation, you really want to focus on chronic diseases, by the way, are things like heart disease, type 2 diabetes, obesity. Really anything that's preventable is a chronic disease. And how do you prevent it? It's actually through lifestyle modification and health education as well. So I'm a big believer that workplaces are effectively little mini communities, and when it comes to health problems that sit in workplaces, they're actually the same as population health problems that exist in the wider community. And so we just see it mirrored, but in a micro community, which is the workplace, with a specific demographic.
And isn't that interesting? Because actually your workplace then has such a potential to positively or negative impact the health of that community, that microcosm, right, of society, being the workplace. So, I mean, we've done a lot of work in looking at talking to people around burnout. And obviously that's persistent chronic stress within the workplace that causes this. And then the effects of burnout can be chronic physical disease and mental challenges and mental illness. So isn't it fascinating that actually, and all of that has a massive cost impact to an organization, as well as the individual, as well as that individual's, the ripple effect into home, family, community. So if we then can ravel it all back and look at the value that actually a well-being, focusing on well-being and well-being programs at every and any stage of an organization, at any size and economic environment, has such a positive ROI, actually, both from an individual and collective and organizational level, because the more well and productive your people are, the less time they're going to have off, the more engaged that they're going to be, the less turnover you're going to have. We know attrition is hugely costly. So this is why I truly believe that employee well-being is a strategic priority, and it should be something that organizations should look at. It's fascinating. And the one last thing I'd love to find out from you, you're working with a lot of organizations. What are the people, the employees? So, we've spoken about the leaders and the benefit to leaders and the benefit to organizations. What are people enjoying? If somebody's listening to this podcast, they're going, okay, I'm going to start on a wellbeing program. What do the people want? We know the benefits to organizations and leaders, but if somebody was going to start with something, what are the employees? What are they really enjoying at the moment? That somebody would go, yeah, that's that, and I know it's not, there is no one size fits all, because we've got, the younger people, we've got generational workforces, but what are the activities or parts of the program that you're getting great engagement with?
Yeah, no, great question, and you're right. It's every client is slightly different, but I'll summarize what we're doing right now for companies and what basically drives what is the most engaged right now. We obviously offer a lot of different services at Pinnacle that include things that are in the preventative health space. There's also health education. We've created a club called Pinnacle Performance Club, which is all around performance and education and coaching. So to answer your question, though, the number one engaged service at Pinnacle Health Group right now, and actually annually as well, you might be surprised, it's actually a skin cancer check.
Really?
As an initiative. And the reason why, well, the assumption that I'll tell you why I think it's the most engaged. So basically we would do way more than 20,000 skin checks a year across different organisations all over Australia and New Zealand. And where I'm surprised by this one as well, because you're probably thinking, oh, there's probably something more fun than a skin check assessment or a skin cancer assessment. And
well, it's certainly more useful than a fruit bowl.
Yeah, that's true. Now, the reason why I think this is the most engaged, and this is just one of many different services, of course, within a program, but the reason is that what we've surveyed and find, and how we follow up, is that when we've surveyed these people afterwards, 71% of them, for 71% of our clients that have done these skin checks, it's their first ever skin check.
Wow.
Skin cancer check. Yeah. And what we find as well, and this is why we talk about why it's such an impactful one, is that naturally through doing so many skin cancer checks, we pick up skin cancer in these employees. And so what we've and each campaign is different based on, we've got clients that are working outdoors, they're obviously a higher risk, but in the last month there's been 10 that we've picked up, 10 melanomas that are obviously like, gee whiz, this is pretty serious. So then they get referred, and then they get treated. And so the feedback we get from that is, my workplace has literally helped save my life in this case, because I didn't know about it. I've never had one, and I wouldn't have got one unless it was offered. So that's our number one. That's our number one service. And yeah, it's not a exciting fitness challenge or anything that's crazy, like you said, fresh fruit or yoga, those types of things. But it's a really important one, because if you think about it, blokes are terrible at going to the GP. Women are better. However, these types of services, if you bring them to the workplace and you promote it properly, you get high engagement. And we don't really care about the engagement. We care more about the results and the outcomes. So when we do prevent someone from developing further an issue on their skin, it's a massive win for us, and we celebrate that as a team. And obviously at the time of recording this, it's going into summer, or in Melbourne it still looks like winter, but it's going into a warmer period, and so we're absolutely flat out with our dermoscopist nurses that are flying all over Australia getting heaps of this work done. So that's our number one thing, highly engaged. The second one, which I might mention, and please cut me off if I'm talking too much, but the Pinnacle Performance Club, which is the new service that we're offering, basically it's health education, but instead of it being a what I call a JOW, which is just another wellbeing workshop, what we've done is we've turned it into a interactive health coaching session. So basically every speaker or educator that we have through the Pinnacle Performance Club, we've got some awesome speakers that speak on working parents, women in leadership, mindfulness, meditation, all the different pillars, and career wellbeing as well, all the different pillars of wellbeing. Mm-hmm. These are highly engaged because we've changed up the style of how you're meant to do a workshop, which is probably for the bane of my, I hate that word, by the way, a workshop, turning it into a health interactive coaching session. So these are done in person. And what we're finding now is that as the world has gone back to being a little bit more in person, our requests for that service have increased quite a lot, because people want to connect again socially in a workplace. We know that not everyone's lonely, but 1 in 2 Australians are reported feeling lonely after COVID, or still COVID, but after COVID. So those opportunities to connect socially in the workplace are important. And on I do a podcast, Well Workplaces, and your episode's about to come through, episode 77, I think, Rebecca. But I chatted with someone the other day who is in the world of design and looking at how they design workplaces. And he said that workplaces are going to start to look like homes. So a place where people can relax and collaborate in a more informal way. And so all of our services around health coaching are really around how can we make this a bit more more connected, because we want people to not come back to the workplace, but come together so that they can, enjoy each other's company. And instead of that leader that feels burnt out or not doesn't know how to have one-on-one conversations, he can have a coffee with them all in a all at once, or connect with people in the real world.
I think that's so important. And a couple of things, social capital, social connection is incredibly important for well-being. So, just bringing people together is going to have a positive impact on well-being. The other thing that came out with that second option there is people don't know what they don't know. And people can only take action when they have awareness around what's available or what might be wrong, or I'm making these choices because that's what I've always done and it's what I've always known, and that's the only option I have. And it's like, well, actually if these are all the other options, so with that health coaching, it's like you're creating an awareness and options for people that might need them, but they wouldn't necessarily know it's available. I think it's brilliant. And even just the contrast between what I think a lot of people will think a wellbeing program looks like, maybe, yogurt and fruit bowls, but, skin checks, health coaching, it is vast and it is broad, and it really, can be then tailored to what is your organization's goals, what are the outcomes you're looking to deliver, who is within your workforce, because we do have some organizations with multi-generational workforces, and align it to those strategic requirements of an organization in terms of whether it's employee engagement, acquisition, retention, and so forth. Tom, it's been so good talking to you. Wellbeing, as I say, I think is critical now in the future of work more than ever. So thank you for these insights. They've been brilliant.
Oh, I could talk all day. So yeah, I'm glad you're wrapping me because I could just keep talking. So yeah, thanks, Rebecca. It's been a lovely chat as always.
It's been great. Thank you very much. Thank you for listening. To find out more about how triiyo can support your people, visit triiyo.com.